Hypertension, commonly known as high blood pressure, occurs when the blood pressure against your arterial wall is high, and this happens over a long period of time, and it is known to be a silent condition because this can be going on for a long period of time without you experiencing any symptom or even being aware of this. The normal blood pressure reading for body should be within 120/80 millimeter mercury. So once your blood pressure is above 140/90 millimeter mercury, and this particular reading shown to have occurred more than one time, that's in subsequent blood pressure readings, it is known that you have what is known as high blood pressure. So actually, before high blood pressure can be diagnosed, an individual's blood pressure should be above 140/90 millimeter mercury more than once. So when you come to the hospital, and or even when you check your blood pressure at home, you notice that consistently more than 1, 2, 3 times your blood pressure reading is above 140/90 millimeter mercury. It is what is known as high blood pressure. And usually high blood pressure has two types, and the types are usually based on what causes it. We have what is known as primary hypertension and what is also known as secondary hypertension. When it comes to primary hypertension, there is no known cause, and most persons that have hypertension, this is usually as a result of another medical condition. So we have conditions such as kidney failure. So people that have chronic kidney disease, chronic kidney disease can cause high blood pressure. Some persons that are diabetics for a long period of time, causes of high blood pressure. The causes of pressure can be divided into three major causes. The first one is lifestyle. The second one could be genetic, and the third one could be as a result of a medical condition. So when we talk about lifestyle, what are the kind of lifestyle that will predispose them to high blood pressure? One of them is excessive intake of salt. Salt. When you're diet salt, it can cause high blood pressure. The second one is when your diet is high in saturated fats and processed food, because processed food actually have a lot of when people that a lot of fast food, because fast food too is more salt and high in saturated fats, and once your meal is high in saturated fats, this increases your cholesterol level, can also lead to predispose you to high blood pressure. Lifestyle that can predispose you to is lack of physical activity. So those that partake in a sedentary style can predispose pressure. Excessive alcohol consumption, take tobacco, things that are under lifestyle that can predispose someone to high blood pressure. Then the second major cause, which I said was genetics. Genetics has to do with your family line, your family tree. So those that have a parent or a sibling or someone in their family line that is hypertensive, they are at risk of having high blood pressure. And then another cause of high blood pressure is medical condition. So medical conditions like people that have chronic kidney disease expose you to high blood pressure. Those that are diabetic, diabetes is a risk factor of high blood pressure. And even people that have hormonal imbalance. Hormonal imbalance is also a risk factor for high blood pressure. How can high blood pressure be managed? High blood pressure can be managed by one, medication. So if your doctor finds out that you are hypertensive, your doctor will place you on a medication. Please ensure you take your medications. Once your doctor has placed you on high blood pressure, once you do not take your medication, you are at risk other ailments like stroke, heart attack, chronic kidney failure as a result of poor blood pressure control. So please, if you're on blood pressure medication by your doctor, ensure you take it. But once you are hypertensive, there are some lifestyle modifications you can introduce that will help you manage your blood pressure effectively. That doesn't mean that you shouldn't take your medication once your doctor has placed you on medication. These lifestyle intake of salt. 2, reduce your intake of saturated fats. Reduce your cholesterol in food you eat. Reduce your intake of fast food. Down on alcohol if you can, but if you can alcohol, ensure you exercise, exercise, and exercise. Exercise will help you control your blood pressure. It will make you keep fit, not just your blood pressure. Relax, avoid stress, ensure you very well. Ensure you have a minimum of 8 hours of sleep every day. Tension, if diagnosed, cannot be completely reversed, but it can be to control your blood pressure effectively as ensuring you reduce your salt intake, ensure you reduce your intake of tobacco, if possible, ensure you eliminate your intake of tobacco, ensure you reduce your stop alcohol intake, ensure you eat a healthy fiber and low in saturated fats. Ensure you drink a lot of water. Water is very, very important. It is advised to take at least 2 to 3 liters of water every day, and for males, men to take at least 3 liters of water every day. This is beneficial to our body. If you're able to introduce this simple lifestyle modification, you'll be able to help reduce your risk of having high blood pressure if you don't have it, or ensure you properly manage your blood sugar for those that have already been diagnosed with high blood pressure. Today is World Hypertension Day. Help to ensure you control your blood pressure, because if you do not control your blood pressure effectively, know that you are at risk for heart attack, stroke, kidney disease, other more severe health ailments. Thank you very much. Next, bye.